Thank you to the organizers of this conference for the opportunity to present today. This is much appreciated. The title of the presentation is The Role of Heat-Not-Burn, SNUS, and Other Nicotine-Containing Products as Interventions for Epileptic Patients Who Take Phenytoin and Smoke Cigarettes. For the purpose of this presentation, Heat-Not-Burn, SNUS, and other nicotine-containing products will be referred to as combustion-free products. Phenytoin is a drug that is widely used worldwide for the treatment of epilepsy. This is my disclaimer slide. This presentation reflects my personal views. The research was funded by a grant from Philip Morris, South Africa. This research was published in the journal Toxicology Reports in 2022. The primary objective of this study was to determine whether combustion-free products have a role to play in epileptic patients who take phenytoin and continue to smoke cigarettes. The secondary objectives will be explained in the next slide. A structured literature review was conducted in 2019 and 2020. 35 studies were evaluated. The pathway of phenytoin metabolism was mapped. The effect of cigarette smoke on phenytoin metabolism was assessed. The effect of nicotine on phenytoin metabolism was assessed. And any overlapping pathways between phenytoin metabolism and the effect of cigarette smoke and the effect of nicotine on phenytoin metabolism was assessed. The influence of nicotine on epilepsy in humans was also determined. So this is the parallel Michaelis-Menten and first-order elimination model. We published this data or this model in the journal Therapeutic Drug Monitoring in 1999. The data was collected in South Africa and analyzed at the Food and Drug Administration in the United States of America. CPSS is the steady state serum phenytoin concentration, which this model predicts. VM is the maximum metabolic rate of phenytoin in the liver. This parameter model indicates that smoke influences VM, the maximum metabolic rate of phenytoin. To determine the individual VM for a particular patient, theta 1 is multiplied by the weight of the patient plus theta 3 times theta 4 for race, theta 5 for smoking, and theta 7 for age. The calculated VM, which is these factors all multiplied, will be substituted in this particular equation. VM substituted over here, and VM is substituted over here. So the bottom line of this is that smoke increases the metabolic rate of phenytoin, which is VM, by a factor of 16%. These are the results. This is the pathway for phenytoin metabolism, as indicated over here and here. When combustion of cigarettes take place, combustion of tobacco, cigarette smoke is produced, which contains polycyclic aromatic hydrocarbons, which induce cytochrome P450 enzymes. And these enzymes induce phenytoin metabolism and increase the metabolic rate of phenytoin by 16%. These blue blocks over here relate to nicotine. Nicotine does not overlap with phenytoin metabolic pathways in humans. Nicotine does not trigger epilepsy in humans. However, nicotine does induce seizures in animals at higher doses, but these results cannot be extrapolated to humans. And in epileptic patients who smoke, they're already using nicotine. So taking these three factors into account, nicotine can be used in epileptic patients who smoke and take phenytoin. Hence, with combustion-free products, which primarily contain nicotine, they can be used in epileptic patients who take phenytoin and smoke. Cigarette smoke increases the metabolism of phenytoin by 16%. Hence, when patients are switched from smoking cigarettes to combustion-free products, the dose of phenytoin will probably have to be reduced. The conclusion of the study is that combustion-free products containing nicotine should be considered as alternatives to smoking cigarettes for epileptic patients taking phenytoin and who do not quit smoking. If nicotine does not contribute to the increased metabolic rate of other medicines, similar to phenytoin, then there is an important role for combustion-free products in patients who take medicines that are affected by smoking. Patients should be encouraged to switch to combustion-free products such as heat-not-burn, SNUS, and other nicotine-containing products. The potential for drug interactions after smoking cessation should be considered. The dose of selected drugs should, in all probability, be reduced because the enzyme-inducing effect of cigarette smoke is removed. And this is important for clinicians to note. Thank you.